So I want to talk a little bit about what we know regarding the genetics of Parkinson's disease. Okay, so little recap. Parkinson's disease is a progressive, incurable, irreversible neurological disease that affects millions of people in the United States. Numerous genetic causes have been identified, which is great news, with most symptoms beginning after the age of 60. So Parkinson's stems from certain neurons within the brain that spontaneously and progressively stop producing a vital neurotransmitter called dopamine. Dopamine is involved in numerous biological functions, but most notably in Parkinson, the deficit manifests in severe motor dysregulation. So patients will develop tremors, move very slowly, that's called bradykinesia. They'll develop stiffness and things like poor balance. Initially, patients report feeling like they shake inside, with symptoms initially not very obvious to others. With time, though, this becomes so extreme that patients are unable to perform activities of daily living, like driving or dressing and cooking, because they can't be coordinated enough. Patients will notice that they feel weak and unsteady and chronically tired. They may drag their feet, shuffle their steps, or freeze up, and the medical term for that is called festination. So starting and stopping movements become very difficult, like standing up from a chair to begin walking. Eventually, reflexes will also fail, and this results in the patient tripping and falling, and they may require, well, eventually they will require a wheelchair. Eventually, cognitive problems also develop. The patient will find it harder to remember things and process information, to multitask, make decisions, or judge distances. Up to 40% of patients report changes in their taste, smell, and sight. So, psychosis and hallucinations are reported actually in like 20 to 40% of patients who take medication for treatment. So, while visual hallucinations are most common, delusions can also develop, such as paranoia. The patient may be convinced that others are plotting to hurt them or steal their money. I've even had patients who called the police and they unfortunately ended up in the ER. Persistent delusions and behavioral changes cause considerable stress on family and friends that care for these patients. Depression and anxiety, for sure, inevitably develop, which ultimately worsens patient outcomes, and it makes the symptoms of Parkinson even harder to treat. Patients will generally feel sad and lose interest in their hobbies. And because of their tremors, patients tend to withdraw from social situations, and which then again worsens the depression and anxiety. So it's very easy to see how they get caught in this unfortunate spiral. They end up with panic attacks and excessive fear, anhedonia or apathy can creep in. They also tend to just speak less because it's so difficult, to get the words out. And then they kind of lose their facial expression. Sleep disorders are very common in people with Parkinson's disease, with a lot of patients reporting much difficulty falling and staying asleep. They may develop muscle cramps, nightmares, night terrors. They may actually lose control of their bladder while they sleep. That's called nocturesis. And so patients can actually also accidentally roll out of bed and severely injure themselves. Excessive daytime fatigue affects up to 75% people with Parkinson's disease. So medications used to treat Parkinson's disease frequently worsen daytime fatigue, unfortunately, because they act to decrease the excessive tremors, right? So they end up kind of being, well, they are very sedating. Some report episodes of suddenly falling asleep, or better known as like sleep attacks. If a patient develops these symptoms, they should seriously consider no longer driving. And that's a really hard conversation to have with your neurologist. In large surveys, patients report that chronic fatigue is the most disabling symptom, unfortunately. In later stages of the disease, patients will develop autonomic dysfunction, which means, that their heart rate will be all over the place. Same with their breathing rate. They may have like strangely increased or moments where their sexual drive is increased and decreased. They're going to have a difficult time urinating or not being able to control urination. Their blood pressure will be variable. They could be constipated. They may even have issues with sweating. Sometimes patients actually develop random pains, which is reported in about 40% of patients. So they may experience like quick stabbing, burning, or tingling sensations. Um, Patients will develop difficulties with fine motor movements, like moving their eyes, lips, swallowing, speaking. And when these develop, caretakers must be wary of the patient accidentally choking. They can also develop skin rashes called seborrheic dermatitis, which occurs most commonly on the scalp and kind of behind the ears, or it could be in the ears. And this is easily treated with various prescription creams, and most patients respond very well to those topical medications. There are several disorders that can present with Parkinson-like symptoms, but are not true Parkinson, such as progressive supranuclear palsy, multiple system atrophy, corticobasal degeneration, Lewy body dementia. All of these, however, do not respond to typical Parkinson disease medications.